Your pelvic floor. This is a huge topic we've talked about on BDA Baby before, but we're back to talk about it again, all phases of life, before, during, and after baby. You don't even have to have a baby to talk about your pelvic floor. You do need awareness about it, which is why we are here talking with Dr. Marcy Crouch. Her Instagram account is called The Down There Doctor. I have been following her. I love everything that she puts out there because it is so well done and informative about the pelvic floor. So we're going to talk to her about all of the questions you guys submitted and also just about pelvic floor health before, during, and after baby. So let's jump right in. Every single time we talk about pelvic floor, just like the subject in general on BDA Baby, we get so many questions. And I feel like it's honestly because this is a subject that you're doing such a great job at talking about openly, especially about something that's not necessarily comfortable for a lot of people to talk about. And people like to be able to anonymously ask questions because it's not comfortable to like go and say, oh, I leak pee when I sneeze, or oh, I have painful sex, or I'm pregnant and I'm freaking out that what if that means my sex life is never going to be the same? So we have a plethora of those questions and subjects to tackle today. But before we do that, why don't we just talk about how you even got into the subject matter of pelvic floor PT?
Yeah, I know. It's like people are always like, why did you choose vaginas?
Yeah,
And I'm like,
it's a great
so
question.
I know it is a great question. I actually didn't know anything about pelvic floor or pregnancy or birth or anything when I went into PT school. I had just gotten married. None of my friends were having kids. It was like not even on my radar. And I remember this like it was yesterday. One of my professors, we were in anatomy, and she started talking about the pelvic floor. And she used an example of a woman who had a pretty significant tear during delivery. And then she talked about all of these issues that this patient had for years afterwards. And Katherine, I remember like where I was sitting and what I was wearing. And I looked at that diagram and my jaw just dropped to the floor. And I was like, wait, you tear during childbirth? What do you tear? Like it
Yeah.
just completely rocked my world. And it actually kind of was a little bit of a blessing in disguise because I loved physical therapy. I loved the human body. I loved all of that, but I was feeling like a little disenchanted with kind of the traditional model that physical therapists are in. You know, you're in the super busy clinic, you see 6 patients an hour, you have aides, it's like kind of all over the place. And I really love one-on-one connection, especially with women. And so I was afraid that I had chosen the wrong career. I was like, oh no, this is a
Uh-huh.
mistake. So the more I learned about pelvic floor and pregnancy and postpartum rehab and all of these conditions that affect so many women, as a student, I was just like all in. And that was something that I became super passionate about. And I got involved with the American Physical Therapy Association when I was a student and just really did a lot of research on my own and being like, oh my gosh, why there's like no PTs out there that do this. This is like almost every single woman who has a baby. You know, what is happening from a medical community standpoint? You know, we're doing all of these things for people that have knee surgery or
Right.
shoulder surgery, and we're doing nothing for women who have babies or C-sections. It's like there's this huge disconnect. And so I just kind of realized, I was like, this is it, I'm in, and like hit the ground running. And that's really all I've ever done in my career. You know, people are like, oh, my ankle or my knee. And I'm like, no, I don't know.
You're
Tell
like,
me
that's
about
not
your
me.
vagina. Yeah. How's your pooping? You
Yeah.
know, like I was like, tell me everything.
Yeah, I mean, I think it's, I obviously didn't really my oldest daughter is about to be 4, so I didn't really hear much about the pelvic floor, just the word pelvic floor, let alone physical therapy for your pelvic floor until I was pregnant with her. And it seems that, if it's generations before me, if it's even generations younger than me, it seems like all women that I know now are talking about your pelvic floor, aware of pelvic floor PT. It seems to be that someone in your position is a hot commodity right now and more than ever. Is that accurate?
I would agree with that. Yeah. And I really credit social media kind of to this resurgence of what is pelvic floor and kind of, what do we do about it? Because a lot of the times, especially in, my oldest is 9 and my youngest is 7. And even when I was practicing before I got pregnant, I really didn't quite understand what all of it was until I had my kids. And then I was like, okay, I get it. And that was kind of right around the time that social media was starting to become, now this search engine, right? And people are feeling comfortable, like you said, kind of from this anonymous background to talk about these things and find other women and other people that are dealing with the same thing. And I really think, it is an uncomfortable taboo topic for some. And there are more physical therapists out there that are doing this, but it's definitely not standard. And it should be, and we can talk about that. But yeah, I would think that more people are feeling comfortable being like, okay, this is not normal and I don't want to live like this. And the answers that our moms got and our grandmothers got and our friends and our sisters are unacceptable. This kind of like, oh, well, that's just part of what happens, when you have a baby, and like, oh, you just have to wear pads and diapers forever. It's like this kind of younger generation, our generation is like, yeah, no, I don't want to do that. Like,
Yeah.
that's not the answer, right? Like, that's not the quality of life that I want.
What's even more interesting to me is that this is a subject that people who haven't even had kids, are diving into. There are people who are, I have friends and cousins, and, I know so many people who haven't had kids that are seeing a pelvic floor PT or that are interested in it or talking about it. I know people who are pregnant doing it, postpartum doing it. And then also, people who are much older that are in my mom's generation who are hearing about this for the first time. And, it's obviously generational to be able to talk openly about something like this. But it seems to be casting such a wide net of just women of all ages, all phases of life being aware of what their pelvic floor is and
Right.
whether or not a PT is right for you.
Yeah, and the thing I really love kind of about this shift in mindset around it is that we are seeing a lot of women coming in and seeking out answers who don't have symptoms or dysfunction yet. And that's really this like preventative piece that I'm so passionate about. And really what I'm trying to change is this like, okay, we have these birth injuries, we have these pelvic floor dysfunctions, they last your entire life. I mean, one of the main reasons why older women go into nursing homes is because of incontinence. But that incontinence started when they had a baby. So
Right.
it's like it just gets worse and worse and worse and worse. And I'm just like, okay, let's equate this to any other musculoskeletal injury, right? And it's like we need to start looking at this from the lens of prevention. So when women are coming like you said, that don't have symptoms or are thinking about getting pregnant or just pregnant now and want to kind of prevent this, that is what make my heart sing. I mean, that is what I think really will institute long-lasting change for women everywhere. And you would not believe how many older women and my mom's generation and even people just like 15 years older than me, 20 years older than me are like, oh my gosh, where were you when I had my babies? Like, where were you
Yeah.
30 years ago? And it's like, there's so many layers to why we're not giving women what they need, but it can affect everyone. And even just not from like a pregnancy standpoint. I mean, we're seeing young women athletes, like jumping athletes, gymnastics, volleyball, like dynamic sports, like they have pelvic floor dysfunction. They're leaking urine, and it's like it's not even related to pregnancy.
It kind of leads into the question of when do you even seek out the help of a pelvic floor PT? Because, you know, there are people who are wondering, like, is this for somebody who's pregnant? Is this for someone who's postpartum? Is this for, someone who all of a sudden has painful sex and then needs to seek out the help of a pelvic floor PT? So getting right into it, I mean, when do you go to a pelvic floor PT?
All of it, like any time, really. So I think any any sort of dysfunction or symptom that's not normal or typical, right? And so I think we need to distinguish here between, especially in the pregnancy and the postpartum population, common and normal. Okay, so like it's very common that people have pelvic floor dysfunction after baby, right? We know this. 1 in 3 women leak urine, 9 out of 10 women have painful sex after baby the first time. I mean, that's a huge group of our population. Common, because so many women experience, doesn't mean that it's normal, okay? Especially if we didn't have these symptoms before baby. So like, why is it considered, oh, okay, that's just how it is now, right? So I would say at the onset of any symptom, okay, leaking pee, constipation, pelvic organ prolapse, which is like heaviness in your vaginal canal. I see a lot of runners who have this kind of like undiagnosed hip pain, and it's pelvic floor related. I go in, I treat their pelvic floor, and they're like, oh my God, that's my hip, that's my bursa, that's my hip joint. And I'm like, no, that is a pelvic floor muscle. So anything that's like not getting better with kind of traditional orthopedic treatment would be an indication. I also think any sort of painful vaginal penetration, and this could be tampons, fingers, speculum exam, sex. Sex and vaginal penetration should not be painful. Okay, it should not be painful. First couple times, probably a little uncomfortable, but it should not cause pain and lingering pain. And that is definitely a sign, whether you've had a baby or not, that it's appropriate to see what's going on from a pelvic floor standpoint. So there's a lot of kind of layers here. But like we talked about earlier, the prevention side is super important too.
The idea also that a lot of this is tied to OBs. Do you find a big connection? Because I remember when I heard about a pelvic floor PT for the first time and I brought it up to my OB and they were kind of like, you know, oh, like, it's, you don't need to do that. And I, by the way, I was pregnant at the time. They're like, oh, you don't need to do that. And now the language has changed in just, under 4 years of, yeah, we offer this. Here's a great place to go. You look at other countries and my friends who've had babies in other countries, and that's part of their healing routine is seeing a PT for their pelvic floor. So do you feel like that's now a kind of a better relationship that OBs, if somebody comes in and says, I have painful sex before even having a baby, or they're pregnant, or they're in menopause and they are complaining about their pelvic floor, that OBs are now recommending people see pelvic floor PTs?
I think it's more than it was, like you said, in the last 4 years or so, but it's not widespread and it's not standard, which needs to change. But I think with the younger OBs and the younger gynecologists and urogynecologists, they're learning about these adjunct therapies that are proven in the literature and that are safe and inexpensive and effective. And so it's kind of like a no-brainer, right? Like, why wouldn't I send these patients to physical therapy? So it's changing for sure. It's not where I want it to be, but it is changing, and that gives me hope that it will start to become as standard as all of your prenatal appointments and your postpartum appointments. That's my hope, but we've got a long way to go.
Yeah, I mean, in so many spaces of
Oh my
women's
gosh,
health.
yeah, it's like
Very
that's a
long way
whole
to go.
nother podcast.
I know. So pelvic floor PT, you can see before, during, after baby. Don't even have to ever have a baby. You can go if you have anything that's symptomatic or anything that you want to explore. And pelvic floor PT can be external and internal. So that's a big clarifying thing, because I feel like people get intimidated by the idea that that's like a jarring idea of it being only internal or it being external. You mentioned a runner. I also just heard of a runner friend who saw pelvic floor PT and found huge relief, has not had a baby, not interested in having any, but benefited from it as well.
Yeah, for sure. And I will say, for the caveat that, if we as clinicians, pelvic floor PTs, are thinking in our diagnosis and assessment and exam that there is a pelvic floor issue, it is, best practice to be able to do an internal and say like, okay, this is my hypothesis, these are my findings, obviously, but we will never do an internal exam on a patient that doesn't consent to it, right? And there's a lot of things that we can do externally if a patient is uncomfortable with that idea. It's not like, for me, I want to do the most that I can for everybody that comes in, and I've had tons of patients who have been like, I'm super uncomfortable with internal, I don't want to do it, like, can you still help me? And I'm like, yeah, absolutely, we can do that, but I'm also going to know my limitations, right? So I'm not going to say, I think it's like this, if I can't feel it, right? Which is completely fine. And this is where you use your clinical expertise and the literature and your experience in the clinic and your training and kind of all of these things. So I think you bring up a good point where I don't want that to be a reason that people don't come in, right? Because they're like, oh my gosh, I don't want anyone to like put their finger in my vagina or put their finger in my butt or whatever. It's like, it's like, let's like do what we can from an external standpoint. And if we can get it, 30% better and that's good for you, then like, I'm happy.
Yeah, no, it's a huge clarifying subject matter. So, okay, I want to get to some of the questions because I feel like a lot of them are also like we can go through. So, pelvic floor, the idea of having a baby. Everybody's like, my vagina is never going to be the same. If you have a vaginal birth, especially, but even a C-section. So, first question, will your vagina ever be the same post baby?
Oh, this is like so loaded. I love we just like hit the ground running, Catherine. I love it. She's like, no BS. Like, let's just
It was
go
like
in it.
the most commonly asked question today, and
Yeah.
every single time we talk about this is everybody being like, I mean, when I was in high school, I remember all of my girlfriends in high school being like, I mean, your vagina is done after you have a baby for the first time. When you get pregnant, just, say goodbye to
That's
your
it.
vagina.
Yeah.
So,
Like you might as well
true,
just jump off a cliff. Like
yeah,
you're done.
true
Yeah.
or false?
That's so funny. So, what I say is the vagina is magical and it can stretch and do so many. It's like one of the most incredible parts of our body. It really is. Like, it's just a miracle in there.
For
Will it
sure.
be exactly the same as it was before you had a baby? No. No. Is my shoulder muscle exactly the same as it was when I was 21? No. Like our bodies change and that's okay. But what we need to make sure of is that the structures and the body parts that we can influence, right? Like muscle and joints and things that we need to support us and keep us healthy and decrease symptoms, we want to make those as functional as possible. So if we're talking about like the vagina, like, oh my gosh, is it, now like this Grand Canyon and like, is it just gonna be like flopping in the wind and like what happens? It's like, like it depends. There's like a lot of factors here, but
Right.
that doesn't necessarily mean that it's like not going to work or sex isn't going to feel good or that, you're going to be like wearing diapers all the time, right? It's like we need to start thinking about pelvic floor and our body as like, okay, we're not bouncing back, right? We're going to bounce forward now. We have a new body, we have a new everything. And so like let's make it work the way that you want it to work in whatever capacity that may be.
The other thing was a lot of people, my younger cousins always are curious about this, about tearing during childbirth. I remember before I had my first daughter, I was like, oh my gosh, is this like a thing that's just gonna happen? It's an automatic thing that no matter, what, your vagina tears or changes in some way when you have a baby.
Not an automatic guarantee. It's not a written guarantee. There's lots of women who have vaginal deliveries without any perineal tearing or pelvic floor tearing. And what we see in the literature is that most women will experience some sort of vaginal or perineal tear. So I interpret that as kind of like, okay, this is my area, right? Like PTs are the best people to be in this area because this is muscle injury, this is connective tissue, this is scar tissue. So what do we need to do to reduce the risk of the higher degree tears? Because we see more dysfunction when we get into the 3A, B, C, and the grade 4 tears. And then, of course, any sort of use of instruments like vacuum or forceps, we tend to see more tearing and an episiotomy, which is like the cut, like the surgical incision.
Yeah, which they don't, I hear that they don't do that as much anymore.
No, thank God.
I know, but you ask our parents' generation, and
Oh,
that was
everyone.
like routine.
Routine. Yep, it was everyone. It was like, oh, because they thought that if you cut, then you would have less trauma, right? And it's like easier for the baby to come out. But this goes back to your question of like, is everyone going to tear? And it's like, not everyone is going to tear the amount that they would cut. You know what I mean? So you're introducing a pretty significant laceration when that person may not have had that. And they were seeing all of these problems postpartum with episiotomy, as far as like fecal incontinence and pain and all of it. And they're like, oh, I wonder why we're doing it to everyone when they don't need it. Yeah. So again, a whole nother podcast. That's like a whole nother one.
Old-fashioned episiotomies.
That's right, old-fashioned episiotomies. Yeah. But yeah, the tearing there's a lot of factors. So not a written guarantee, and we want to try to reduce the risk of them.
Okay, painful sex, we talked about it before, but this again seems, and I don't know if it's just social media, but it seems to be a subject that you hear people who aren't even pregnant or haven't even had a baby talk about painful sex. You obviously hear about it a lot with women who have just had a baby and are having sex for the first time after they hit their 6-week mark, and they're like, let's go. So you hear about those horror stories. I feel like you hear about all the time of women who are like, I had a friend who was like, it's been 6 months and I'm terrified at the idea of having sex after I had my baby. And I'm like, I'm nervous about it. I'm scared. But so I have friends who like have different, and I totally understand the fear behind it. 'Cause you're like, is this going to be the same? Is this going to be painful? So painful sex, the subject of painful sex, is that one of the biggest reasons people come into your office?
It's one of that I would say there's 3: painful sex or painful vaginal penetration, for sure. Like I had just a college girl come in the other day, never had a baby. She's never had sexual intercourse. She can't have a speculum exam. They had to put her under for her IUD. Like she's never been able to do it. So she's like, I really would like to wear a tampon. And I'm like, reasonable. Yeah. Like completely reasonable. So yeah, painful sex is one, or penetration, leaking urine, and then prolapse kind of are the big ones. But painful sex can be from a couple things, especially if we're talking about like postpartum. So one would be just the strain of the pregnancy. Okay, pelvic floor muscles are skeletal muscle, right? They're like your bicep. So think about like holding a weight for 9 months in a bicep curl, and then the weight's just getting heavier and heavier and heavier and heavier and heavier, like growing baby, growing placenta, growing uterus, all the things. And then, all of a sudden I just have to drop it. And now I have to like work again with no rehab. So muscles can be tight. It's like overuse. It's kind of like shin splints, but in your vagina.
I love that visual.
Yeah, right. And you're like, oh, or like if you get a Charlie horse in your calf.
Yeah.
It's the same thing, right? Or you're like clenching your jaw and you get headaches. Same thing happens in your pelvic floor. Like exactly the same, because it's the same muscle, same type of muscle. So that's one reason, right? Because you're trying to put something in and the muscles are like, whoa, and so like that's going to hurt, right? And they take up space in the vaginal canal when they're tight, take up space. The second reason is like a tear, like we talked about. So you could have scar tissue, right? Scar tissue lays down kind of wherever it wants. It's like a matrix. It does its own thing. And that's fine. That's what it's supposed to do. But what happens is that it like pulls down on the muscles. So it's kind of like anchoring them down. So when the muscles have to stretch to allow a penis or a speculum or whatever you're putting in the vagina, the muscles have to stretch, and that scar tissue is like, we're not going anywhere. That's going to be painful, especially when there's so many nerves around the opening to the vagina. A lot of those nerves can kind of get bound up in there. Mm-hmm. And if you have ever had a surgery anywhere else, and you have scar tissue like that, it gets pretty sticky. Like that's a very sensitive area down there. So of course, makes sense. And then the third for postpartum is hormones. because we drop estrogen after we have a baby. So this is why a lot of people with C-sections are like, why does my vagina hurt? Like the baby did not come out of my vagina. Like
Oh, interesting.
it
Okay.
hurts. Like, and it's hormone related, because when we drop estrogen, the tissue around the opening to the vagina, it almost becomes like a postmenopausal vulva. We call it vaginal atrophy, because estrogen makes tissue like plump and happy and fluffy and, you know, like lubricated and all the good things. And then without estrogen, the tissues kind of like deflate and they get a little bit dry. And you might have experienced this, I know I did, after I had a baby. It's like you wipe after you go to the bathroom and it's like like super like sandpaper vulva, and that's because of estrogen. And so when you're trying to like expand tissue and put something in and you don't have kind of that like natural fluffiness, is kind of my favorite word for it, that's going to be painful, and it's going to feel like that skin is like ripping or tearing or like super itchy, if that makes sense.
That sounds just
we're so blessed. Hashtag blessed. Blessed.
Okay. We talk about how, you know, with pelvic floor PT come in at any time. When it comes to women who are pregnant, you know, I know my OB will talk now about the importance of PT postpartum. But do you recommend that, as a pregnant person myself, do you recommend that you start doing pelvic floor PT during pregnancy, or does it depend also on like what the pregnant person's level of activity is?
Yes, 100%. 100%. Regardless if you're sedentary or you're an Olympic athlete, yes, you need to come in to prepare for the delivery, whether it's a C-section or whether it's vaginally, 100%. And if you're already experiencing symptoms in your pregnancy, even if it's just like back pain or pubic bone pain or leaking urine, you need to get in earlier than like 36 weeks. Usually I say if there's like no symptoms and people are just kind of cruising, come in around 34 weeks, 36 weeks, we can start some birth prep stuff to do that reduction of vaginal trauma. If you're having symptoms prior to that, or if you had a delivery before, like a previous delivery that didn't go great and you kind of are nervous about it, let's come in earlier and start working on it. And then postpartum, usually what we used to do is like, we wouldn't see anyone until about 6 or 8 weeks once you're cleared for sex and exercise. But now I want my patients coming in as soon as possible. I won't do internal until they're cleared, but this goes back to that idea of the early recovery. Like, let me teach you how to get out of bed. Let me teach you how to carry your baby so your back doesn't hurt. Let me teach you how to, like, what posture you need to be in when you're feeding so your C-section scar doesn't like cause you problems, right? Let me help you poop after having a baby. That first poop, like,
that's always a big topic. People
oh
are like,
my gosh,
what is it like?
oh, it's PTSD, you know, it's like all of that, you know, it's like you have to carry this huge heavy car seat around.
Yeah,
you
which
know,
is
and like,
ridiculous.
yeah, and you just had a C-section.
Yeah.
How are you going to sneeze when you have like an incision that's stapled shut? You know, it's like all of these little tiny things that make a big difference. And it's like, why are we waiting until 2 months? Like, we need to be doing that in the hospital.
I know. Ideally.
Off my soapbox. But yes, that's
yeah. Okay. So come in at any time, definitely before. And if you've had a baby before or 4 babies before, the likelihood of you experiencing a similar pregnancy or postpartum journey, is that high? Is it everything is totally different, or
everything is totally different? It's really interesting, actually. Every patient that I've ever seen who has had more than one is like, this pregnancy is so different. This pregnancy is so different, right? And my 2 were completely different. Everything from like the beginning to the end of both. My second one, my son flew out. He was 10 pounds, flew out and like drove us home. I mean, he was like, it was ridiculous. I mean, my husband was like sitting on the ground and I was like, what are you doing? He's like, that was really fast. That was so fast. Oh my God. And like drinking an apple juice. And I was like, oh, I'm sorry. Was that hard for you?
Yeah, I know.
I'm like, don't even get me started.
Yeah.
But totally different. So I would just say, you know your body best. You know your body best. And you know when something isn't right, or if you're concerned about anything just from a mental health standpoint, come in. That's what we're here for. You don't need to be going into birth like terrified. Like that's not going to help anyone.
One of the more popular questions that I always get when we talk about pelvic floor health at all is it ever too late? There are people who say, my baby's 9 months and I'm leaking when I sneeze, or when I jump, I leak, or I have painful sex. There are people who are a year and a half, 9 years, 15 years, longer. Is it ever too late to start pelvic floor PT and repair your pelvic floor?
Never. The oldest patient I've ever seen was like 95. And I saw her, and I saw her daughter, and I saw her daughter's daughter. I saw all generational. And
Three
so,
generations in there.
yeah, generations of pelvic floor. No, never too late. It's just like any other muscle in your body. It's never too late to exercise. It's never too late to move. It's never too late for anything.
So if you're somebody who has, had painful sex, had leaking, or just feels like, okay, this is what my life is going to be like, I chose to have kids, or this is what my hormones are doing to me, you're saying that you don't need to think that way.
No way. No way, no how.
Okay.
And like this shouldn't be like your punishment for choosing to be a mom or having a baby. You know what I mean? Like,
yeah,
we don't accept this for any other activity. Why would we?
Does pelvic floor PT also help with painful periods?
That's a great question. It can, yes, absolutely. Because let's say we have like an endometriosis or something systemic that's causing a lot of the painful periods. Obviously, we can't do anything for the disease process of endometriosis, but there's so many musculoskeletal problems surrounding the disease that cause painful sex that we can take care of with pelvic floor PT for sure. And it's interesting because a lot of times people will go in for endometriosis surgery, they remove all the endometriosis, and then they're still having pelvic pain. And it's like, yes, the endo may or may not be the cause of it. Usually it is, but there's also all these other things. So it's like, so yes, 100%. Even if there's like IBS, we can help with that too.
At what age would you say, if you're not having symptoms, is time to see a pelvic floor PT?
I would say if you're not having any symptoms and like you're doing great and you're happy, like don't stress. But if you want to come in, 100%, I love the preventative side of things. At any sort of inkling of, that's a little bit different, or, oh, that's weird, I'm getting a lot of UTIs, or weird, I had a yeast infection and it got treated, but like I'm still having pain, come in. Things that are not normal for you.
Okay.
Always
and what
warn.
about pregnant people? Should every pregnant person see a pelvic floor PT?
If I was ruler of all, yes. Yes. I think it's super important to get, like I said, a baseline and be like, okay, here we are, in your first trimester, second, third, okay, I'm noticing these things. So like, let's work on this and then let's get you ready for delivery. Let's train for delivery like we would train for, soccer or baseball or whatever. And then I think at every 6-week follow-up or before, it should be this, like there should be your OB or midwife or whoever's, checking you out from like a medical standpoint. And then you should walk out of the room and walk right into a pelvic floor PT's office. Like it should be standard. It should be exactly what you're getting postpartum. And especially if you've had a C-section, 100%. So yes, everyone.
Okay. And when you say training for delivery, are you referring specifically to the perineal massage that we hear a lot about in the book and read about?
Great question. Perineal massage is it's a hot topic. I mean, a lot of people, we get a lot of engagement in our social media about perineal massage because there's a lot of kind of ideas about it. So yeah, I love perineal massage, but I don't love YouTube perineal massage. Like perineal massage needs to also be connected to other, right, to other things, right? So what I do to help train people for birth is I teach them how to bear down and push. I teach them how to breathe with their pelvic floor. We find what position is the most advantageous for their pelvic floor lengthening, right? We go through kind of all of these things. Think about like sport specific training. For volleyball player, for example, your practice is game like settings. So the same thing needs to be for delivery. So I have patients come in and I'm like, okay, we're gonna go side lying and I'm gonna hold your top leg and you're gonna bear down. And like, how does that feel? And we'll use something, inside the vagina, like a dilator or another tool. And I'm like, push that out. Can you feel it getting pushed out? Okay, that's what we need to replicate in delivery. Or I'll do perineal massage while they're side lying and pushing at the same time. So when it's delivery time, they're like, oh yeah, okay, I got that. Like, I've been here before. This is not, I don't have to figure all this out right now when like the baby's flying out of me, right? It's like, okay, I've done this. Like, I know that I feel comfortable, half kneeling or squatting or side lying or whatever the case may be.
I mean, we hope that a baby flies out.
Right. Right.
Oh my gosh. Okay. Well, I mean, this has been so informative for me as a pregnant person to just like even talk about this. Even though it's my third time, I always think that this is such a fascinating space that I'm excited about getting more attention and focus. And no matter what phase of life you're in as a woman, it's so important to be able to be in touch with your pelvic floor and even be aware of what that is. Because I feel like prior to this dialogue, we only hear about like, do your Kegels or, yeah, that's it. So this is, and the way that you're doing it on your social media is so amazing because it's like entertaining, it's approachable, it's digestible, it's non-intimidating and not like crazy, overwhelming and daunting. So thank you so much for taking the time to do this. I'm excited to do this again because
Thank
of
you.
this being such a popular topic
Yeah.
and thank you.
Yeah, thank you.
Thank you so much to Marcy for having such a great and informative chat about the pelvic floor. I feel like I know everything I need to know to really train for childbirth now and also my experience postpartum. And this was just such an informative conversation, and I can't wait to do this again for all phases of pregnancy, postpartum, and beyond. Thank you.